this week is Mental Health Awareness Week. What's it mean to you? What comes up for you when we talk about that subject?
Oh my word, lots of different things. You know, I know the theme this year is around body image, and you know, I think that's really valid. I mean, I've had times in my life when, you know, I really didn't like the way I looked, and thought that if I looked different, then it would, I don't know, something would change. You know, my nose. You know, when I was younger, it was like, oh, why don't I have a nose that is like other people's, those nice little neat things. And, you know, being on profile, on camera, would not be something that I would even think of doing.
Yeah.
And, you know, and I guess, you know, in saying that, we're kind of laughing about it here. On the scale of, I don't know, dysfunction.
Yeah.
I don't like that word, but of the way that it affected me. It didn't affect me in the way that other people perhaps are affected by things. But it took me, I don't know, well into probably my 30s to kind of be okay to look in the mirror and go, yeah, that's me. That's who I am.
You're a decade ahead of me, because I know when I first started working on my life, I guess, I did some mirror work actually, and I would look in the mirror and I would just sob, and I think it wasn't until well into my 40s that I could look at myself and go, do you know what, you're all right. And you may have heard us talking this week that what precipitated Fresher Fridays in my mind actually was our daughter's anorexia. Yeah, it's just a really big subject, how we feel about ourselves. And
yeah, and I'm reminded of, you know, I've told you this before, but when I had the treatment for breast cancer, you know, thankfully years ago now, and I knew I was going to lose my hair, and it was like, oh, what will it be like? And you know, and thankfully with my experiences and the work I've done around my own mental health, you know, when I did lose it, it was a real exercise in kind of like, oh, I'm not my hair. But I hadn't known. I hadn't really known how I would feel until I started noticing it just falling out. Yeah, I don't know. It's it can go all kinds of different ways.
what strikes me about this conversation is, you know, both of us are here talking about how we address these challenges we had about how we feel about our bodies and how we look. And I think there's kind of this assumption that you should know how to do it. But in the experience I had with Catherine and what we're talking about here, actually I've had to find some stuff that helps me. And even now, there are practices that I put in my life that keeps me feeling okay with all that stuff. It's not a given that just by living my human existence that my well-being, my mental and emotional well-being is okay. I work on it. I put things in place that has me stay mentally and emotionally well. You know, if I walk to be physically fit, but there are other things I have to put into my life to stay mentally fit and healthy.
Yeah, and well, we're sat here surrounded by greenery, and we both know, and anyone who's heard us talk knows that, you know, we think that's really important. But something that's come up for me, I don't know, in the last couple of days was when I was getting a bit stressed with looking at the cash flow and what have you. And, you know, I asked my husband for help. And it seems like a really little thing, but actually it wasn't, because I got into the habit of doing stuff on my own in a lot of different ways. And so that I know that I can ask for help, but still, what am I trying to say? Knowing made no difference. Yeah. You know, I still slid into, you know, a pattern. Yeah. And it's very easy to do that. And so, so one, just speaking I guess, and Mental Health Awareness Week, it's about, inviting people to share and open up about what's going on for them. And that's one of the healthiest things that I do. And I get that, we're blessed in the way that we work together. Sorry, I'm going off on a little ramble here.
And it's all good, yeah. So I think some things that we've got self-care practices that keep us in check and keep us mentally and emotionally well. And I think what you've just said there about sharing stuff, talking to other people, being connected to other people, they're part of us staying mentally and emotionally well.
Yeah.
So we hope there's been value in our little chat for today. If you have any challenges, if any of this stuff is resonating with you, do get in touch. Follow us on Facebook, Instagram, Twitter, and if there's a session running near you, do come out and join us, because we'd really love to connect with you.
Yeah, we would. And just to say, if what we're talking about doesn't resonate with you, reach out to someone.
Yeah.
Kind of almost doesn't matter who, but reaching out is a first step.
Yeah.